Good morning, all of you. Shyamkishore. His name is K. Shyamkishore. K means what? Everybody says, what is K? K is his father's name, Kunhambu. K. Kunhambu. He was joined in this department in 1991. He was a easy student of this college only, 1985 batch. Then he became a PG student here. Then he has joined a lecturer, then associate professor, then professor, and then he has become head of the department at TNMC Naya Hospital. Who he is? He is a philosopher. He is an inventor. He is a teacher. He is an instructor. He is a teacher of teachers. And he is masters in anatomy to hai, lekin computer, how to make MCQs in medical education. He has taken many lectures regarding how to calculate marks, internal assessment, result within a short period. In this hospital, he has 6 PG students, that is Dr. Jyoti Narkede madam, then Dr. Preeti Bolwar, Dr. Manoj Borkute, Dr. Sridevi Bangle, Dr. Raju Bokan, and Junaid Labbe. Junaid is at this moment at D.Y. Patil Medical College. My interaction with Dr. Shyamkishore is when I joined here, I was as a lecturer in 1997 in this department. Near the dissection hall, we have small compartments, and the next compartment I am sitting. He has done everything in this department. For the improvement in this department, he has done many arrangements of exam schedules of UG student as well as PG student, OTPT, BPMT and nursing also. He has taken many lectures for this institution, other institution, and for the medical education also he has taken many lectures. He was, I should say, he was running or chalta firta grey matter. He knows everything regarding anatomy also, and he has a solution of each and everything which is faced by anybody in this department or other departments. He gives the solutions to it. He knows Bhagavad Gita also very well. One day I have told him that, sir, what is the meaning of this slok? Then he has given me a book of Marathi Gita. And he said me that, see, in the second adhyay, 13th or 14th shlok, and he has explained afterward everything to me. His students are not in Mumbai, they are all Maharashtra, India, all over world. The students are there, and they were, I think they were seeing this YouTube link, YouTube live. In this department, he don't hesitate to take any lecture or demo. If suppose anybody is absent, he says, "Arey, main tension nahi lena." So he takes the demonstration also, he takes lectures also, he takes everything, whatever is required for the department. And if suppose I am making a exam schedule or a lecture schedule, sir, आपको क्या lecture दूँ? So he says, जो बचेगा वो मैं लूँगा. And he gets the difficult topics. That is of genetics, then CNS, limbic system, applied anatomy, grips of hand, walking cycle, which is not taught by any others. One and only the Shyamkishore, every year he takes all these lectures and applied anatomy of whole body. This is about few things about Dr. Shyamkishore. Many of you want to speak about him. From his family, we have with us his brother Nanda Kishore and his wife Sheila. Dr. Shyamkishore's wife Jisha madam, that is Jisha Shyamkishore madam. Shyamkishore's Dr. Shyamkishore's daughter Priyanka. His son Vishnu is busy with the exam, so he is not there. मी त्यांच्या कुटुंबाच्या दुःखात सहभागी आहे. त्यांच्या आत्म्यात शांती लाभो हीच ईश्वरचरणी प्रार्थना. ओम शांती. तुम्हाला सरांबद्दल तुम्हाला बोलायचं असेल तुम्ही बोलू शकता. एवढंच बोलून मी माझे 2 शब्द संपवतो. तुमचा श्यामकिशोर, त्याला डार्क किशोर सुद्धा चे कोठारी सर म्हणायचे, शामू म्हणून हाक मारायचे, श्याम्या म्हणून हाक मारायचे. त्यांचे मित्र तर त्यांना श्याम्या श्याम्या किधर आहे, बट ही इज देअर विथ अस इन दिस रूम बिकॉज एव्हरीवेअर ही स्टँड्स अँड दे टेक द लेक्चर्स. सो त्यांच्या आत्म्यात शांती लाभो हीच ईश्वरचरणी प्रार्थना. ओम शांती.
Before I request Dean Madam to say a few words on Dr. Shyamkishore, we'd like to just show a glimpse of what Dr. Shyamkishore was, is, and will be in the department here and at Nair. Lights on, Kavi. So this was a glimpse of Dr. Shyamkishore. Uh, what a person he was. I'll request Dean Madam to say a few words.
These moments you always feel should never come, that you have to talk about someone who was such a great teacher, is no more with us for the students, for us. I still remember the days when he started suffering from this muscular dystrophy, and he came to neurology OPD for the diagnosis and for further investigation. And we were so scared, to tell him that you have something which is not having a treatment and it's likely to progress slowly. And eventually he came to know, because he was himself was a doctor, and he took it so positively that never there was never that he was depressed and he would not work or something like that. I don't know internally the wife and the children may have seen, but at least in the work wise, he was a real fighting spirit. He continued to work to the fullest extent. He wrote the books and everything he did. He continued to teach. He even gave an oration after I became a dean. So all this he continued. In spite of that, he knew that he's not going to live longer, which is a very, 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 very difficult task for any human being, when you know that you are not going to live longer and you still don't get depressed and continue to work to the full. So I think I really, really appreciate what qualities he had in his uh, heart, he had in his mind, and the spirit which with he lived all throughout till the end. I think it is really, we all have to bow down to him and his family, who supported him so well. And I think both the departments were also very supportive here, and then he was shifted to Nair. And I think we all have to learn from such soul, that how do you you know how do you face a situation, how do you gather a courage to face a situation, and how you continue to live happily even after such diagnosis. In neurology we often face this, that we tell this thing there is no treatment, and we always find that patients succumb, patients feel very bad, they go. But here was a different person. So I'm sure he's going to be a missile for so many people in future. Anybody who has this any such disease, they should learn from him that whatever God has given you, accept it with vigor, accept it with happiness, and try your best for whatever life you have. So I really say, I mean, I'm very sorry for the loss which the family has given, and I wish God gives his soul good. I think all of us are there with him, and for us, he's still with us. So may God rest his soul in peace. And I have my all sympathies to the family also. Thank you very much.
On behalf of the institute, there's a resolution that has been made, and I'll read out the resolution and I'll request Dean Ma'am to hand it over to the family members. Dr. K. Shyamkishore was an excellent teacher of anatomy and medical education. Besides being a great academician, he was a wonderful human being. The Department of Anatomy of Seth GS Medical College has witnessed his unending enthusiasm and love for students, staff, the department, and the institution. The lecture theatre has witnessed his excellent teaching skills, and the staff members of the department have witnessed his kind and helping nature. With his sad demise, we have lost a friend, philosopher, and guide. He was the shining star of the institute. All the staff members of Seth GS Medical College and KM Hospital pray to Almighty to give strength to his family members to bear this irreparable loss. I request Jisha Madam to come forward to receive this resolution.
I request Rupa Madam to say a few words.
I'm pleasantly surprised and very happy to know that Dr. Kushale constantly spoke the way as if he is. He continuously used his present tense. And when he mentioned that Gita second Adhyay, 12th stroke, he had explained to him. So I realized that he has absolutely assimilated what is mentioned in 12th slok of Bhagavad Gita, where Lord himself says, it was never a moment where I was not there. There will never be a moment where you will not be there. He tells this to Arjun, and he tells to the entire Mahabharata, all those who were present, that any of this will not be there. That's why everybody is eternal. And that's, I'm very happy that you mentioned him as if he is still here. Very good. I think we have to live by that spirit. And I am glad that Dr. Shyamkishore not only taught others that, but he practiced himself, because despite, as Dean Madam mentioned, knowing his diagnosis, he never gave it up, the joy of living. And he, as I learned from his wife Jisha, that Madam, he always told me that because I have got this dystrophy, thousands of people are spared of carrying this burden. And that is what the philosophy we have propounded in all our books, Dr. Manu Kothari and myself. So he also assimilated that philosophy, that each burden which God gives you for having a disease, by probability you happen to get it, but because of that you spare number of individuals. Dr. Shyamkishore came to us as an undergraduate student in 1985. As I mentioned earlier, somewhere at Nayar, I met him first time at the time of exam, and that is where I realized how stoic he was, because as usual I asked everyone how are they settled, and so he mentioned that he has lost his father, but he was not showing any, depression because of that. He was quite stoic. And then in 1991, again, this is, I'm repeating, I said earlier, it was courtesy neat that he was not given his first choice of pharmacology, and he was given anatomy. And then when after 15, 20 days, when he got his first choice, he said, no, now I am settled in anatomy. I do not want to go for pharmacology. So he continued to remain in anatomy. A great gift from NEET to us, to anatomy and students, and of course to GS Medical College and subsequently to Nair also. And then emotionally, he was very stable. You could never see him disturbed, dejected. And as Jija said, he never cried. So very stable. Of course, his IQ was unquestionable, EQ unquestionable. And as I see from his friend circle, that his social quotient was also excellent. And he took care of everyone, everything. He taught everything. Besides, people have not mentioned this, computer and everything to so many people. And in fact, in anatomy department, when he came in, computer was just making inroads. He made anatomy department very stable with his knowledge of computer, and we were very comfortable. And as head of the department, he gave us lot of support. No department can run without able support from all the individuals who work for the department. Department can never run by one individual. So he has been great support, and I am very proud of all anatomy teachers and students of this department as well as of the Nair Hospital, that they took extreme good care of his physical inability, never made him feel that you are not capable, and that allowed him to work till the last day of his existence over here. He did give a lecture on that day, and that's what he lived fully his life. A great message to all of us, how to live and die with shoes on. Oh, it is always very dejecting when a teacher loses his student or her student. For me, it's the same scene. Anyway, but he has only taught us not to feel that way and take Gita's message to the heart. I wish everybody from the family, all his friends and well-wishers, that he must be very comfortable wherever he is, and our good wishes will be with him. He is with us. We will be with him. Thank you.
Thank you, madam. I request Dr. Natarajan sir to say a few words. Madam, have a seat. From Nair Hospital, Sion Hospital, everybody has come, and also the previous staff who has retired, they also come because of his love and affection.
But been called earlier, so I just honored the call. 9th of December 2025, the anatomy department programmed the centenary meet of the alumni of our institution. Possibly Shyamkishore might have seen that as well, without realizing that he may not be able to be present in person for the same. The next day, 10th December 2025, like any other day, usual day went off. So, though there were just about 15 days, I'm forgetting the date of the centenary celebration, 27th morning. Yeah. So around 15 days notice was there for people to register and come for the function. 11th morning, 4 a.m., I generally don't see the mobile at that time. But I don't know what happened. It's just, I switched on the mobile and I saw a message from Dr. Yuvraj Bhosle from Nair on the social update group of the institution that Shyamkishore is no more. I was wondering whether I'm dreaming. Odd hours in the morning at 4. No. But then I was not sure whether we would continue with the centenary alumni meet under the circumstances. But Khushale has planned in such a way that that event has gone undisturbed. Concurrently at Nair, where Dr. Shyamkishore headed the department, Dr. Yuvraj Bhosle coordinated a condolence meet on the 13th or 14th, 15th day, somewhere around, if I'm not mistaken. And I was taken by surprise when there's one more meet organized at our institution. Generally, a condolence meet is, if held, only once at one place. And I think, at least in my awareness, this is the first time I'm coming across. We are mourning the same person twice. Place of birth, GS Medical College, as far as the academics is concerned, vis-a-vis Shyamkishore, where he has spent almost about 30 plus years. And for all the service that he rendered at our place, he was aptly rewarded with the headship at Nair, which also he has carried off quite well. I was there for the meet there as well, and the hall was full there. The slides there and the slides here ended with the term, he is a hero. No second word about it. But I will just change the O to A and add one more E. H-E-E-R-A. Hera in Hindi. Nothing short of it. Absolutely selfless. It's, as I would like to repeat one component, that it's sad that I am mourning my student. But on the other side, even if one student of yours becomes a diamond, teacher's job is more than done. I rarely interact with people. I was with Shyamkishore for more 30 plus all through his tenure here. Barring maybe I was shifted as HOD to Science from that for short span. And mind you, as at Nair I commented that I had not asked him once about his illness. I know he's not well, but then no point in asking about it. On the contrary, try and promote whatever positives are all going on. And in a similar frame, subject matter wise, apart from regular day-to-day activities being conducted and instructions from a senior to a junior, academic interaction, I remember only 2 occasions in 30 years. Once, while writing the program of the department, daily program of the department, the board, the usual error which occurs of English vowels of which one comes first, like say for example, neuro, the E comes first or the U comes first. I had put U first and E. He pointed out, sir, is there something amiss here? It took some time for me to grasp that EU equation. Okay, I thanked him for that correction. It feels good. See, accepting your mistake, even if it's pointed out by a student, you rectify yourself and you start analyzing why this problem in English language. Color, there's British spelling and American spelling. American spellings are easy. But British has single standard. American has double standard. Some places they leave the vowel, some places they put the vowel. Nevertheless, that was one occasion. Second occasion, he and Dr. Pratibha Athavia across the corridor here, they had a query about whether the muscle brachioradialis can be called supinator longus. Okay. So obviously if they're asking me, that means both of them have had a discussion among themselves and then they are verifying. So my focus was only on terminologies. So in that context, I said every muscle can have 1,000 names based on various aspects, based on what criteria you select. So if you're going to name brachioradialis, which is named after the attachments, if you name it after its function, it's a supinator. So you can certainly call it supinator. But then if there's one more supinator, which is called supinator, this is the longer of the two. So there's no harm in calling it supinator longus. Automatically that one becomes supinator. barring these two interactions. Mind you, no interactions in 30 years. But it's not necessary you have to interact. Words are not always required. If a person has a difficulty, XYZ will contact you, or other way. Every person has his or her own format. I guess I wanted to speak the last because I didn't want to encroach in the time of what others would like to speak. But then, thanks for the opportunity. I will just end with 2 lines from a Hindi song. Please bear with me for my inability to sing properly like the regular singers, but still I'll make it. जीवन के सफर में राही मिलते हैं बिछड़ जाने को और दे जाते हैं यादें तन्हाई में तड़पाने को.
Natarajan sir. Now I request Junaid. He is a student, PG student. Come. Now he is in DY Patil. So there are many seniors are there, but I choose him because his interaction with Dr. Shyamkishore is more, and other also. But as a his PG student, he is his PG student. I called him.
Good morning, all respected senior teachers and colleagues and all other who have came here. Myself, I'm Dr. Junaid Labbai. I'm currently Associate Professor at DY Patil, Navi Mumbai. So I started my academic journey in anatomy at Seth GS Medical College. I still remember the date, 11th of June 2015 was my first day at GS Medical College, and I had taken admission in personal counseling round. And the day when I came here, I met the head of the department. Dr. Bhuyan ma'am was the head of the department. And I was so fortunate enough that madam gave me a choice to select your PG teacher. Madam gave me a list of 10 PG teachers, and madam asked me, since you are the only student who have joined for this batch, I'm giving you a chance to select your PG teacher. And believe me, I didn't meet Shyamkishore sir before selecting sir as my PG guide. I interacted with all the teachers, senior teachers, and the non-teaching staff and all. And somehow I felt that Shyamkishore sir would be best for me, and I still don't regret that decision. Sir was like everything for me at GS Medical College. Yes, other teachers were also there, but my personal interaction with sir was like, sir don't used to speak much. Like as a PG student, students usually have fear with their PG guides, but there was no fear as such. Sir just gave me timelines. This is the timeline that you have to finish, and sir gave me everything on me. So I just followed the timeline, and whatever helped in the thesis, I didn't need any biostatistics help for my thesis work. Sir gave me all the formula, Pearson's status. Sir knew everything about how the data has to be calculated and how it has to be done. So I'm grateful for whatever sir had taught me, and I still follow those principles whenever I'm teaching my students at DY Patil. With these few words, I would like to stop.
Thank you, Junaid. I request from Blood Bank, Dr. Jayashree Sharma madam, to say a few words.
First of all, my prayers to Lord Almighty for Dr. Shyamkishore's divine soul to attain Sadgati. And as Dr. Natarajan sir had said, when I felt shocked when I saw the message on that KM social update group regarding the sad demise of our dear Dr. Shyamkishore. So he was truly a very genuine, sincere human being, a very good human being. Being in blood bank, I didn't have much interaction with him as such, but I used to see him whenever I used to cross this way, this path. I'm here since 1990 in KEM. So my interaction with him was in the year 2014 or 15, in 15, when MUHS switched to computer, this thing, online entry of marks. So that time I was so new to this, I had zero knowledge about computers. And it was such a big task for me I didn't know how to go about it also. And that time the distribution of stationery and everything, all that exam responsibility was given to anatomy department, and Dr. Shyam Kishore was the head at that time, means he was in charge of that task. So then I came to Dr. Shyam Kishore. I didn't know anything, how to go about, what password and how to make entry and all. So I came on that day, practical exam day, and I told him, sir, I really don't know anything about this. You please teach me. So he was so good. He said, no problem, madam, you just sit with me. And I sat in that computer room and he showed me everything. And he made me comfortable. He said, madam, there is nothing to get worried. And this is the way it should be done. So then, I had a little confidence, and then I went back for my practicals again. So our practical used to be for one day, and our exam went on till 8:30 evening. So, and when I went to that MUHS site, it had closed, I think, and I was trying to call up MUHS, and they were not responding. So then I called up Dr. Shyam Kishore. So he said, just don't worry, madam. I'm just waiting for you. Actually had told me, if you have any problem, you can call me. So then, when I called him up, he said, don't worry, madam, you don't panic. We will see tomorrow. So he just guided me. He said, you just make a manual entry of the marks in your mark sheet. And then you can whatever put it in the envelope and do the procedures. Tomorrow we will see. So next day I came. So next day when I came, we again sat in the computer. So that time I was not able to make entry at all. So again, I was scared. I said, how to, then online submission is a must. So then he spoke to MUHS, and then he told them that you please change the date to, they said, because the date is changed, that's why you're not able to make the entry. So he went out of way to tell MUHS. Maybe if I would have told, they may not have listened to me also, because they were saying, you finish the exam, you should have finished the exam before 6 and all. It was not possible, because our exam, I cannot force the examiners that you finish the exam before 6 and all. So he spoke to MUHS people, and then he changed the date on the site itself to the previous day. And then he himself entered the marks for me, and he did, means everything. He completed the procedure. So that I'm really grateful to him. Always throughout my life, I'll be grateful to him. That moment he had helped me, and he was so good anytime. Still I can remember this thing, that time how he was so good, and whenever I met him, and he always spoke to me so well. My heartfelt whatever prayers for him, and my condolences to his family. And I have no words. I'm not finding words. I was really, that time, that moment, that point of time, it was really a great help for me. And he's such a good human being. That's what I can. My prayers for his soul, and my condolences to his family. He will always be remembered by everyone, not only by everyone, whosoever has come in contact with him. Everybody will remember. And he's a Krishna devotee. I could remember, because that time when I panicked, he said Hare Krishna. So I also said Hare Krishna, so again I also say Hare Krishna.
Hare Krishna, madam. When I was there in Nair Hospital, I have transferred here as an head of the department. From that moment, one person has taken transfer from Sion to Nair Hospital, and that person is Yuvraj Bhosle. So I have told him, "Arey, you are still there. Why you have taken transfer?" So only to see and to take care of this Dr. Shyamkishore. He has taken transfer, and on the last day, he has taken the signature of Dr. Joshi sir. You know? So I request YJB. They call him as a YJB.
Thank you for calling, and I'm speaking on behalf of Nair Hospital. Some other staff members are also here, Seema and Pumpy, but none of us are in a state of speaking. I would not say that I pray to Almighty to give strength to the family, because I was the part of their family. Through every thick and thin, we were together. Our friendship began in this corridor when I had come during my post-graduation at JJ, and I met Shyamkishore here. And the way Shyamkishore was, so he said, "I'm junior amongst the seniors, and I'm senior amongst all the juniors here." You know, he was such a jolly person, and that's where our friendship began. And then when I joined here, I was knowing only Shyamkishore, nobody else. Slowly, I got introduced. I became part of the GS family, and till day I cherish my every day which I spent here. Shyamkishore and me, our friendship was so deep that many times, you know, when he was staying at Andheri, I used to go to drop him to Elphinstone, just because I was the warden of the hostel. I was staying here only. But just our talks used to continue, and I used to drop him, see him sitting in the train, and then I used to come back. This kind of time we have spent together. Jayashri madam at the end, she said, "Hare Krishna." That is one point I really want to speak about, that he was a devotee of Krishna, followed Gita, he followed ISKCON also. But he never made a show of his devotion. Rather, some of you, it must have come as a news that he was a devotee of ISKCON, and rather he was an initiated devotee. He had taken Diksha there, but he never told. A person like me, who every time makes other feel and know that I am a devotee. Shyamkishore never told that he is a devotee. His behavior made others feel that he is a devotee, and that is how a devotee should actually be. That looking at his behavior, people should feel that yes, he is a spiritual person, and that's how Dr. Shyamkishore was. When we had the memorial function at Nair, one thing I made it a point that I didn't cry there. And the reason I didn't cry is because Shyamkishore never cried. Never ever in his single day. We never saw him crying. He never told his problems to us. Only once, Dr. Seema remembers, last year, there was one gallbladder stone which came into his pancreatic duct. And Seema went there to his office, and she was sitting like this. And she asked him that, "Sir, you are in pain?" First time, that was the only once in his lifetime he must have told somebody that I have some pain. And then she said, "Should we visit the casualty?" And he said yes. That's all. Otherwise, there is no other evidence that he told anybody that he's having any pain. In the ICU, he was admitted, and suddenly in the midnight, Seema, we started getting calls that he needs to be put on ventilator. His SpO2 is going down. he refused. Rather, there he called all the medicine, rather he started speaking about why I should not be put on ventilator, because my CO2 levels and all, they are stimulating my respiration. And the way he started speaking, let me tell you, at 12 o'clock in midnight, all the medicine residents in the MICU of Nair Hospital gathered around him. Shyamkishore kept on speaking for 1 hour about respiratory alkalosis and other things. I think they were taking notes also, some of them. And they said, "Ye kaun hai? Who is this person?" All the medicine residents were asking us, "Who is this person?" He is admitted there and his SpO2 levels have gone down, and still he is so clear in his concepts about medicine. He's from anatomy. And we also realized that Sir, like Lopa madam was saying, he was a genius. We have our elective postings, which will be starting now. Last year, Sir conducted elective postings. He gave a case of medicine, he gave a case of surgery, he gave a case of respiratory medicine, and students used to present. We were supposed to discuss anatomy. Sir used to discuss details of ECG. He used to discuss. I think medicine people should also come and would have listened to this. I have recorded some of those sessions, and I realized that this person was really blessed with knowledge, and we have lost him. Rather, even in anatomy, when I came here, I used to see on the board joint 1 by Dr. Shyamkishore. I said, "A joint 1 kya hai?" When we are told to take lecture on joint, 1 lecture on joint, that is over. Then next day I came, there was joint 2. Next week there was joint 3, joint 4, joint 5. Then I went to him, "Shyamkishore, karta kya hai tu?" Joint 5. He had so much material to speak about. I think joint 10 also would not have been enough for him. That much kind of knowledge he was carrying. He was, of course, blessed by teachers like Dr. Natarajan, Dr. Lopa Mehta. Yeah. Yeah. So Khushale sir is insisting, and I would like to repeat that anecdote. When I joined here from JJ, and in this very lecture theatre, I was taking the lecture, and I made a statement. I was teaching pancreas, and I said, the islets of Langerhans are there concentrated in the tail of pancreas. And Divya Vajpayee, who is here with us in nephrology, she raised her hand and she said, "Why?" I said, "Why? Why? This is how it is. It is observation." And I went out. Shyamkishore's cabin was that time in that corridor only. And I said, "Kes ki kya hai tumhare bacche? Why puchte? Why kya hai? Why they are there in the tail of pancreas?" Shyamkishore said, "Sit down, I'll tell you. Islets are endocrine gland. The exocrine gland component of pancreas, they secrete in the pancreatic duct. And those away from the duct become endocrine. And tail is the most structure which is most away from the duct. And that's how they get converted." I said, "Shyamkishore, kaun se book mein likha hai?" He said, "Never ask me for a book." He had explanation for everything. I have many things to speak, but I need to stop here and allow others. But the last thing I would like to speak is how all this happened. Every time, Shyamkishore used to fall sick or anything used to happen, me, his family members, Isha, his brother, we used to be a team to get him out of it. Once when he was sick, we had sent Harish. Harish was staying at New Bombay, and we said, "Harish, don't come to college today, go directly." Harish took him to NGM, and Shyamkishore was saved. And we were so confident that Shyamkishore is able to, do anything and come out of every disease. When he got COVID, or before that, when he had a surgery of his parotid, Samir Regi operated him here. Shyamkishore came out of it. He had COVID. Literally, during COVID times, we tried homeopathy and everything. Every half an hour, me and Jisha madam used to be in touch that, medicine diya, and she was admin. He came out of it. And this time also, on 9th, it happened that He basically last 6 months was getting reflux, GERD. And we were giving him medicines, but still that acid was coming up. So on 9th of December, I took him to ENT, and there were patches around the larynx where acid had done the damage. From there, I took him to chest medicine, and we took a X-ray. Literally, when the HOD there, she saw the X-ray, the diaphragm on the right side was not functioning. It had come up to the level of the fourth rib almost. It was not functioning on. Whoever saw that X-ray, they said, "How is this person surviving?" And that is what willpower is. I said, "Madam, he has tremendous willpower." But then she told me that because this muscle over here, the lower esophageal sphincter is gone, and also because muscles are involved, the laryngeal sphincter is also not. The acid is going into the lung and causing micro aspirations, and this has been happening for last lot of time. But he followed his guru, MLK sir. All of us know how MLK sir left us. He got up in the morning, looked at the stars, woke up Vatsal, and said that looks like I'm getting a left ventricular failure. Shyamkishore, in the same way, went into the washroom, came out, and he said to Jisha, looks like my SpO2 level is falling. Because he was having fever that day. Actually, in the 6 o'clock, 7 o'clock, I called madam. I said, how is he? He said, having fever. I said, give antibiotics. 10 o'clock, he comes out, feels little bluish tinge on his finger, and he says, looks like my SpO2 is falling. Again, they were insisting, let's go to the hospital. But we say, जसे गुरु तसे शिष्य, आणि हे गुरु शिष्य परंपरेचं आपलं कॉलेज आहे. None of them wanted to pass away in a wired state. So one way he passed away very peacefully, although young, although he has left a gap which cannot be filled. But last line I would say that anatomy at Nair Hospital never going to be same again without Dr. Shyamkishore. Thank you.
Yuvraj, your feelings and your connection with Shyamkishore we were knowing, and what care you have taken, we know. I would like to know from gynec department, anybody wants to speak? Gynec department, madam. Please. Because in KM hospital, each and every department, 40 department knows Shyamkishore very well, and everybody is watching YouTube live. So they might have not came because their work and YouTube live they are seeing. I request madam, say a few words.
Basically, I'm not from KEM as UG or PG. So I have not had the good fortune of knowing Dr. Shyamkishore. Came here in 98 and not so much connection with MEU was there before 2012-13. So on a personal note, I have little to remember him by, but what I have heard in last hour or so is something that makes one introspect, the purpose of our being here as teachers, and a lot to learn from him when as far as teaching is concerned, and knowing that beyond the given subject also there are many other things that we can impress upon the students, and we can keep learning ourselves. That's very important, and I will take this message to myself rather than, convey it to anyone else. Um, Thoughts are with his family, and may he rest in peace. Actually, there is something about this rest in peace which is not in our Hindu philosophy, because we believe in Atma being eternal and going into another life or mukti, whichever is the thing. So I do not know about that, but this is conventional way of wishing.
Anybody from physiology department? Physiology? Praveen?
Uh, I've got very close association with Shyamkishore sir, right since I joined this institute as a postgraduate student in 2003. As a student, learned the subject of anatomy, the way he used to teach, and he had the passion and he had a lot of patience also to listen to people, to address queries in his own styles. And as some of you have said, which book it has been given. So, see, book is for reference, but more importantly is the explanation. And if you justify the explanation, I think, and you get convinced, that is more important. And that is what was the power that he had to convince people. And we used to understand the things which were difficult for us as students from him. So that is the initial interactions that I had as a PG student with him. And then, of course, when I joined here as a faculty member, interactions were on a different level. I got an opportunity to work with him in planning the teaching schedule. And I must say that sir had very good memory regarding dates. And this is one thing that is very important when we work to plan schedules. Holidays, how to schedule examinations, what are the nitty-gritties. I think that is the thing that I learned, and I hope that whatever I learned from him regarding this planning thing, I could transfer that to my colleagues who are right now working in it. Then, of course, came my interaction with regards to medical education. And as we mentioned, sir was a master of multiple choice questions. The way you used to conduct the session on multiple choice questions and item analysis, of course, he's recognized nationwide for this particular session. And he has traveled far and wide conducting this session, and then, of course, subsequently online. Because of the interactions in medical education, we also had opportunities to travel together and spend a lot of time socializing. And that, I think, is the time that I would cherish the most. And those times are never going to come back. While preparing this presentation, I purposely put the slide 3 musketeers there, and that was one of the images from Karad. Almost every year, as a part of their nursing curriculum, Karad Institute of Nursing Sciences used to arrange a workshop on measurement and evaluation. And I started accompanying Shyamkishore sir and Yuvraj sir, I think somewhere in 2010. That was my first visit. And from 2010, I think almost every year we used to have that trip. During that trip, apart from medical education, we used to chit chat and discuss, you say, anything and everything under the sun. And that was some lateral learning of how Shyamkishore sir was as a person that I came to know. Because in academic life, when you interact, generally what happens is we tend to discuss academic matters. But when we get this opportunity, we get to know the person as a person himself. There is nothing that I can say that I have not learned from him. I'm pretty sure that, like many of us, he has had a tremendous impact on me as a person, as an anatomy teacher, and a medical educationist. I will never be able to forget my interactions with him, and even I do cherish the times that I visited his house and en route to our visit to Karad. I still remember, and the masala dosas, the hot masala dosas that madam used to serve, I think that is another thing that is missing. So I pray to God for well-being of Dr. Shyamkishore wherever he is, and close my words.
One incident that the topics which are very difficult topics which is there, and the student says, sir, we have not understood the topic, that is grips of hand. Next Saturday at 12:30 to 4:30, the grips of hand, and he teaches and tell the students there is no attendance. Attendance is full. From morning to 1:30, the attendance will be less, but after 1:30, it is full because of his passion to teach the students, and in relation with their micro structures he teaches to the students. From pathology department, anybody? Sir, pathology department, to speak something. From pharmac department, come. Seema? Seema?
Sir, respected Kushale sir, all the dignitaries on the dais, off the dais. Sir has spoken, said about pharmacology, and my interaction with Shyamkishore sir, as Praveen rightly mentioned, was medical education, and sir taught MCQ designing and item analysis the best. It was somewhere when I came to KM somewhere in 2008, and I was put into UG teaching somewhere in 2009 by Rege madam, my then HOD. And then madam said की राखी तुला ना item analysis करायचं आहे, and it was तो काळ की item meant what I did not know, means I was really very bad. And I said, ma'am, I have no idea. So ma'am said anatomy मध्ये जायचं आणि तिथे तुला शिकवतील. So then I came to anatomy department, and I was guided that Shyamkishore sir will teach. So I said, sir, I don't know anything. The sir said, have you done any basic medical education? That time, these NMC courses were not there. And KM used to run somewhere in 2009 its own MEU programs. So madam made me attend that. And in that program, sir had taken item analysis for nearly 2 hours. There was a 2-hour full session. I think so, sir, along with Yuvraj sir. That time, how to frame MCQs and how to do the item analysis on Excel. And it was that the passion with which sir taught, that even today I can do those things nearly very well. Other thing, as even Sharma ma'am said, that whenever there were any hurdles with MUHS, especially in the tenure of my 2010 to somewhere around 2015 or so, any MUHS hurdles or, sir, and I was center in charge in 2010. So and I was new to this place. So I was not knowing the rules, how to conduct, what is called, block size, how to make blocks in a classroom. All these were very small things. But these small things also sir taught very passionately and sir would never, means to be very honest, I never in my life saw sir anytime angry, irritated, frustrated, which I get at every minute. But I going to sir being so in his own anatomy, itne wo bacche, wo dissection all, but sir would give time, sir would explain, and that was the best quality of sir. He would come to the basic to explain you, even if you are not understanding, sir would take all the trouble and explain you again. So my same feelings that wherever sir is there, sir, you remain happy, and obviously you will be remembered by everyone as the best human being and a best teacher. Thank you, sir.
From microbiology department, I request sir to say a few words. Anybody want to? Vilas from our staff is more friendly with Dr. Shyamkishore.
नमस्कार. दिवंगत डॉक्टर श्यामकिशोर सर त्यांचे कुटुंबीय आलेले आहेत आणि बसलेले ते माझे डॉक्टर्स कर्मचारी वर्ग. खरं तर श्यामकिशोर सरांचं वयाच्या 57व्या वर्षी आकस्मिक निधन झालेले आहे. खरं तर जन्म आणि मृत्यू हे प्रत्येकालाच असतं. ज्यावेळी आपण जन्माला येतो त्यावेळी आपला मृत्यू हा लिहिलेलाच असतो. परंतु सरांचं हे काय जाण्याचं वय नव्हतं. 57 वर्ष किंवा 58 वर्ष म्हणजे हे काय मृत्यूचं वय नव्हतं. त्यांना काही व्याधी आजार होतं, त्याच्यामुळे त्यांचं आकस्मिक निधन झालं. तर मी जवळजवळ 25 वर्ष एकाच ठिकाणी डिपार्टमेंटमध्ये काम करत आहोत. त्यांच्याने माझे संबंध फार चांगले होते. त्यांचे घरचे कुटुंबीय मला सर्व अगदी ओळखत असत. त्यांच्या सुखदुःखामध्ये मी सुद्धा जास्त सहभागी होत होतो. सरांबद्दल बोलायचं तर मी एवढंच सांगेन, ज्यावेळी सर लेक्चर घेत असत त्यावेळी हा हॉल तुडुंब भरलेला असायचा. आजकाल तुम्ही बघताय की लेक्चरमध्ये किती मुलं असतात आणि किती नाही. ते खरोखर बसायला जागा नसायची. फर्स्ट इयरचे तर यायचेच विद्यार्थी, परंतु सेकंड थर्डचे पण काही एखादा टॉपिक त्यांना जर अडत असेल तर ते विद्यार्थी सुद्धा येऊन इथे बसत असत. म्हणजे एवढी त्यांची शिकवायची ख्याती होती. तर ते एक हुशार व्यक्तिमत्व होतं आणि एक साधी म्हणजे माणूस म्हणून एक ते चांगले होते. त्यांची साधी राणी होती, उच्च विचार होते. मुलं त्यांना लेक्चर असायचे त्यावेळी आम्हाला सरांना बाहेर काढता नाकी नऊ यायचे. कारण 4:30च्या लेक्चर 5 वाजले तरी सर लेक्चर सोडायचे नाहीत. मग आम्ही येऊन आतमध्ये सांगायचो, सर 5 वाजले सोडा. 5 वाजता जरी लेक्चर सोडलं तरी मुलं इथं घोळक्याने असायची आणि परत ते सरांना प्रश्न विचारत बसायचे. मग इथून आम्ही सरांना बाहेर काढायचो. पण सर परत कॅरिडॉरमध्ये मुलांना घेऊन बसायचे. कॅरिडॉरमधून पण बाहेर काढायचो, कारण आम्हाला बाहेरचा दरवाजा बंद करायचा असायचा. त्यानंतर सर एमएलटी मध्ये खाली असायचे, ते कट्टाडा त्यावेळी होता आपला, तिथे लेक्चर घेत असायचे. गार्डनमध्ये लेक्चर असायचे. तुम्हाला खरं वाटणार नाही की सरांनी प्लॅटफॉर्मवरती सुद्धा मुलांना शिकवलेलं आहे. हे आम्ही बघितलेलं आहे. त्यावेळी सर इकडे कुठेतरी बांद्र्याला राहायचे काहीतरी त्यावेळी. म्हणजे एवढं त्यांचं मुलांवर प्रेम होतं. बघा, त्यांच्या कुटुंबावर फार मोठा आघात झालाय, तो भाग तो आहेच, परंतु विद्यार्थ्यांचं सुद्धा नुकसान किती झाले बघा. त्यांचे बरेच चाहते विद्यार्थी होते. दुसरी गोष्ट एक तुम्हाला मी सांगू इच्छितो की ज्यावेळी एक्झाम असायच्या, युनिव्हर्सिटीच्या एक्झाम, त्यावेळी आपल्याकडे 400 ते 500 स्टुडंट इकडे बसायला यायचं. सिटिंग अरेंजमेंट करायची असते. त्यावेळी एवढं आपल्याकडे जागा नसायची. पण मग नंतर काय करायचं, का एकच कम्प्युटर आपल्याकडे आहे, ते म्हणजे श्यामकिशोर. नुसतं डिपार्टमेंटचेच लोक गायडन्स नाही घ्यायचे, इतर डिपार्टमेंटचेच लोक सुद्धा ते विचारायला यायचे की सर 500 विद्यार्थी सिटिंग बसवायचे कसे 2-3 थिएटरमध्ये. सर बसल्या बसल्या सांगायचे, थिएटर नंबर 1 MLT किती सीट. त्यांचा माइंड कम्प्युटर असतं. हा रोल नंबर 16, तिथे एवढे स्टुडंट बसवा, इथे एवढे स्टुडंट बसवा. म्हणजे एवढी त्यांची ख्याती होती. असं व्यक्तिमत्व आज आपल्यातून हरपलं आहे. मी सरांच्या आत्म्यास सुख शांती लाभो आणि त्यांच्या दुःखामध्ये त्याच्या कुटुंबियांना ह्या दुःखातून सावरण्याची संधी देवो. कारण का बघा, एकच असतं. मराठीमध्ये एक म्हण आहे, जो आवडतो सर्वांना तोची आवड आहे देवाला. कदाचित ते देवाला सुद्धा आवडलं आहे, म्हणून ते वयाच्या कमी ह्याच्यामध्ये ते दिवंगत झालेले आहेत. मी त्यांना भावपूर्ण श्रद्धांजली वाहतो.
Anybody else in house? I request his brother to say a few words. Anybody from the department, faculty, you want to speak? Sir, come. It is not planned. Anybody can speak.
I know that all have not come for the meeting because it's an online setup. I can understand because what I had seen there at Nair, it was a full house. But here again, I would say ki the number of people attending anything, as earlier all the colleagues have said something about him. I have been associated with him for the last 57 years. The day he was born, I have never seen him working without any passion or any direction. He always had something in mind to convey to the people who are around him. Even for me, even my mother used to guide her and say, yes, you have to be in a position where you are independent of anybody. His children have been conveyed, tomorrow if I am not there, what are the steps you have to take and how do you get out of the problem of missing me and ensuring that you don't, don't miss me and miss your studies or your PG programs or whatever you are doing right now. His daughter wanted to join medical, but she had her own reasons of not being able to pursue. Though she had finished her first year of, she had attended classes for the CET, NEET, but she could not, finish off her studies because of a medical problem. And then she had to change her line altogether and she joined business management with finance as the base. And today she's finishing her final year and she was supposed to be here since 1st of January with him so that he would be teaching her for her final CA exams. But now I think she might be losing out on some percentage of the marks because without the guidance of her father, I think she may miss lot many marks in life. I hope all the students who have, been with him or associated with him get all the benefits and further down the line convey to the future generations to come the ideas, the principles what he followed in life. Thanks for giving me an opportunity to be here with you all. Not a position to be in today. Thanks.
Seema madam. She's from Nair Hospital and she was there with him since from his PG and he also guided her very well. Seema Khamata madam.
Good afternoon, everyone. I can't remember him without tears in my eyes and without pain in my heart. I have not been associated with him for donkey's years. In fact, I wanted to join KM, but I got admission in Nair. But because Nair had just opened PG seats, so I was the second batch when the PG seats were opened. I had no idea about teaching which went on in KM. But fortunately for us, our PG teachers decided that they will have joint classes for all the students. And that was my first interaction with Sir, with Natarajan Sir, with Lopa Mehta Madam, that I came in contact with all these stalwarts who were at KM. And I felt that they had ample knowledge and one could really benefit by being close to them. What struck me about Dr. Shyamkishore sir was that his knowledge was very instant. It was never, I will tell you later, it was always how you access Google, you type and you get the answer. It was like that with him. So later on, when I became a lecturer and I started teaching, I would feel that whenever I got stuck between different books giving different informations, my only point of contact was Dr. Shyamkishore sir. And one instance I still remember, sir was in his native village. He was having his vacation or he was on some holiday, but he didn't let me know that he was there. And sir explained the whole concept to me. He would even tell me why you have to follow or why this is the answer, as Dr. Yuvraj sir said, that he had logical explanation to everything. So there were many ways that he touched my life. One was in anatomy teaching. I think my teaching improved after I started attending the MEU lectures here, and I also became a faculty in MEU. My inspiration was all the faculty here at KM. Then anatomy itself, where we had the quiz and how sir would frame the questions. When he came over there, I used to always tell him that, sir, अब तक हमेशा प्यासा कुएं के पास जाता था, अब कुआं ही प्यासे के पास आ गया है. And I never missed that opportunity of his being a part of our institute and my learning, that every few hours, whatever I was reading, I would go into his cabin and discuss, and always came out learning 10 new things which were not given in the books. Sir was also a very compassionate person. As a head of the department, I think no one had any problem in approaching sir and discussing their personal problems. And sir always made it a point that he understood, he made himself available, he made easy for that person to go through their problems. And that is one unique quality which I feel as a head he has touched the hearts of all the people at Nair, and that is why I think our morning is much more. The other way that he touched me was when I saw sir with his physical limitations coming every day to work and not complaining even once, with the slightest of injuries and with the slightest of pains, we would start complaining, but sir never complained. And I think that he was a star here on earth, and he will always be a star in heaven, and he'll keep on guiding us. And my respect and regard for him will never diminish. And I only want to offer to his family that sir may have gone, but we are still your family, ma'am. So anytime you need us to be there with you, please do not fail to We are just a phone call away. Thank you very much.
Sikandar?
Respected teachers and my colleagues. There are many memories, from our postgraduate days and when I was a lecturer. We used to have the micro teaching sessions very long. Like it was 1 hour session, but we used to it used to get around 2 to 3 hours or many more, and it was completely filled with many interesting facts, many jokes related with the topic. So sir was having very unique way to make simplify the complex and the complicated topic. And he makes so interesting that it becomes very simple at the end of the session. So sir was having very tremendous knowledge, and he was very great teacher, will be remembered by all postgraduate and undergraduate students. He made very long impact on many minds of the undergraduate and the postgraduate students. He will be remembered always, and legacy will be continued.
Anybody other? Madam?
To Dr. Shyamkishore's family members, very sorry to hear about this loss. I lost touch with Dr. Shyamkishore or I used to call him Shyamkishore actually, after he went to Nayar. But when he was here, I don't know how many of you know this, but he'd actually taken up pharmacology. And he took pharmac, and the second day he got very upset. And he said, this is what my colleague Nitya has told me, he was so upset. He said, I don't want pharmacology. I want anatomy. That is what is my love. And during our time, once you have taken a subject, it was very difficult to change it. And then later on, he had to actually give a letter in writing saying that, no, I don't want pharmacology. There are other students who want postgraduate students who want pharmacology, and there is nobody who wants anatomy. So if I leave pharmacology, somebody else will get a pharmacology seat, but if I take anatomy, there's no one who wants it. And this whole thing, poor guy at that time, he went through all this, and then he got what he wanted. So I don't know how many of you know this, but this is how it was initially. So that is what I remember of him. Following that, I remember, that whenever we had any difficulty in any of these medical technology or anything, we used to always approach him, and he used to come and help us. I think people before me have spoken about that. But being just 1 year my junior, I used to, in those days, go to him for any difficulty, because everybody must have said this before me. He was a brilliant guy. And he would have answers to everything on earth. And in his very clear mathematical, sense, he would logically explain something, and it would be so nice to spend that time with him. I did hear about his illness, etc., later on, and how everybody, the anatomy community, helped him through that. And I'm really sorry to hear of this loss, and my heartfelt, sincere condolences to his family members who are here, and also to the anatomy community, to whom he was a very dear colleague and a very dear teacher. And I know that even the students who all remember him, there were so many messages on our groups remembering him as a dear teacher, as a dear colleague, and especially there was a lot of messages from students saying that they will always remember him all their life.
So I request Abhijit Dende sir to is a resolution from Department of Anatomy, and he will read the resolution regarding him.
Here's a resolution from the Department of Anatomy, Seth GS Medical College, and KM Hospital, Parel. Dr. K. Shyamkishore was or is an excellent teacher in anatomy. Besides being a great academician, he is a wonderful human being. The Department of Anatomy of Seth GS Medical College has witnessed his unending enthusiasm and love for students, staff, and the department. The lecture theatre has witnessed his excellent teaching skills, and the staff members of the department have witnessed his kind and helping nature. With his sad demise, we have lost a friend, a philosopher, and a guide. He is the shining star of the institute. All the staff members of Department of Anatomy, Seth GS Medical College, and KEM Hospital pray to Almighty to give strength to his family members to bear this irreparable loss. There are innumerable experiences of Dr. Shyamkishore sir with the faculty as well as the students. One peculiar incident I would like to just highlight. I had been attending his micro teaching class regarding the applied anatomy of the upper limb, and there was one applied anatomy case, anatomist, and everyone was knowing the carpal tunnel syndrome. One of the causes of carpal tunnel syndrome is perilunate dislocation. Now the students had it. What is perilunate dislocation? Sir had a very interesting anecdote about this. What do you mean by perilunate dislocation? You must have seen one movie, that Dhamal, or some movie where the inspector asks, who is going to die first? The people are standing in a row. All other people will go step behind, and that one person will stand in front. I think Javed Jafri. So that means the perilunate dislocation means the lunate will be at the same place. Other carpal bones will displace posteriorly. So that made an impact. The term perilunate dislocation means it's not the lunate which is dislocated. The other bones which are around it, they will dislocate. And the interesting feature that the movie everyone will remember, perilunate, the Javed Jafri and all. So that is how I remember. And incidentally, when Sir passed away, the same day I had a lecture of MBBS students. The same day, 10th December. So instead of wishing good morning, as is the norms that we address all everyone, the gathering, good morning, I said, this is not a good morning for all of us. Okay, this is a bad day. It's a very, very sad beginning of this day, because we have lost a very great teacher, a philosopher, an academician, a teacher par excellence. So I can remember that on 10 December, there's a first MBBS lecture was there. So with this, I offer my heartfelt condolences to Sir's family, and I wish wherever Sir is there, he is at peace and is looking down on the anatomy community and guiding us in this future journey. I request Dr. Kushal sir to hand over the resolution to Jisha madam.
Now I request Jisa madam to say a few.
After my marriage, I learned that I have another family. Its name is KM. So that are introduced me as sir, madam, everybody as my family members, as well as your rules. So all the incidents, all the day-to-day life, everything is related to the KEM department. We are very happy to be here. And sir and madam had helped a lot. So and madam also, I remember her a lot. All the difficult time, all the difficult time, helped a lot. The department, I once again thanks the department of KEM Nair, every elder, respected my teachers. The family is always with me. I afterwards also. Thanks once again.
मी विनंती करतो 2 मिनिटं त्यांच्यासाठी उभं राहून 2 मिनिटं श्रद्धांजली अर्पण करूया. ओम शांती. ओम ओम शांती. थँक्यू तुम्ही सगळे इथे आल्याबद्दल. सगळे टीचर्स, स्टुडंट्स आणि स्टाफ मेंबर्स इथे आल्याबद्दल मी सगळ्यांचे आभारी आहे. डॉक्टर श्यामकिशोरला आपण कधी विसरू शकणार नाही आणि त्यांच्या फॅमिलीवर मोठा आघात झालेला आहे. तर त्या आघातातून ते बाहेर येतील. काही प्रॉब्लेम असतील ते आमच्याकडे या. जसं आता सीमा खंबाटा मॅडम म्हणाले की नायर हॉस्पिटलमध्ये कधीही येऊ शकता आणि प्रियांका तू कधीही येऊ शकते. श्यामकिशोर नाही तर आम्ही आहोत सगळे. सीमा आहे, आमचा प्रवीण आहे, सगळे आहेत. मी सगळे आल्याबद्दल धन्यवाद. कार्यक्रम इथेच संपला असं जाहीर करतो. धन्यवाद.